I am here to talk to you about the Rainer IOL, which comes with a fantastic armamentarium of numerous IOL designs and purposes to satisfy the palate of the ophthalmologist. Raven hydrophobic aspheric IOL. The material has already been discussed by my esteemed colleague Dr. Sandeep very elaborately. What I wish to state is that the asphericity is of great importance because Rainer comes with an aberration neutral technology which makes depth of focus easier. Spherical versus aspheric optics. Spherical optic, you have an area of confusion. Whereas in an aspheric optic, the area of confusion is reduced. In other words, clarity is increased physically. Now, to translate this physical quality into a physiological reality, you need a tool of excellence, and that is the Rainer aspheric IOL. As Amit Porwal has threatened to switch off the slides, I shall jump over them and go to the surgery. And another thing is that this IOL does not vault because the haptics are like shock absorbers and the material is sufficiently designed that way so that even if there is a capsular bag contracture, there will be no such problem. In addition to that, there are these two flanges, and you will have a look at the advantages of having these two flanges in the surgery which is going to follow. The reason for my having verbal diarrhea is Amit Porwal and nobody else. And another thing, among the various IOL materials which you see over here, the 800C or the Rainer IOL has the least rate of complications, opacities, glistenings, crystals, calcifications, etc. The Rainer 1 injector has already been discussed by Dr. Sandeep. Therefore, I shall go straight to the surgery. Now, in the Rainer IOL, there is one-stop shop. You inject visco into that prescribed entry point, and then you have to inject the IOL. I shall show you the video of the loading process, which is extremely easy. And another thing is, in most other companies, the very act of opening the lens box and removing the lens from the box itself is more time consuming than the cataract surgery. Whereas in Rainer Ray1, you just have to take it like the old Hero Honda advertisement, fill it, shut it, forget it. That is the kind of ease of use which Rainer has. It is not only a surgeon-friendly IOL, it is also a theatre-friendly IOL. The theatre sisters will not cut their fingers, they will not cut the lens box. It is so easily done. Now here, this is a mature nuclear cataract, and you can see that the surgery has gone on well, but there is one particular area where there seems to be some recalcitrant cortex. That is how it appears. But then you know that God acts in mysterious ways, and you will see how. It is a huge nucleus which has been hiding behind, which means there has been a PC rent there. Even in this condition where there is a PC rent, you will see how well centered, stable the Rainer Ray1 IOL sits. So we go ahead, remove this big chunk of nucleus, and then we just implant the IOL directly. There is no need for a vitrectomy because there is no vitreous presenting itself into the anterior chamber. So here we go, inject visco, the bubbles are expelled, and then we clip it shut. Yes. Once we clip it shut, we just inject. And because of the flanges which are there in the IOL, it sits perfectly and it remains well centered. And look at the ease with which it goes in. Dr. Sandeep was singing praises about the hydrophilic material. This is one hydrophobic material which behaves almost like a hydrophilic material when it comes to pliability and centration. IOL was launched in So I'll play all three videos at the same time.
ESCRS, I was there. So it's a lovely platform. It up with Visco.
Please have a look at how well the IOL enters into the anterior chamber and the leading haptic goes in directly into the bag. And here in the third video, you will see that there is a ear which comes along with the packet. You just have to catch it by its ear and peel it out. Exactly like how our moderator is doing. If the speakers extend time limit, he'll catch them by their ear and make them sit in the correct place. So Raven IOL is also like that. It comes with the ear, the surgeon can grab it by its ear and peel it off.
And then you must try the Rainer injecting mechanism. It's a one-stop. It is so Visco. It's just one step. Everything is taken care of. Lock in.
This should have been played one after another, but because of the paucity of time, all three are playing together. A hearty welcome to Dr. Mahipal Sachdev. Welcome, sir.
That is the beauty of the Rainer IOL and complete the surgery. So, thank you very much, my dear friends, for watching this.
Therefore, my dear friends, I wish to thank you all for giving me only 6 minutes. This Raven IOL needs lesser than that to go and sit in the bag perfectly. Thank you very much. And another thing, this is not a competition. When you look, to have a strong team, you should not look at another person's strength as a threat to your position. Instead, you should look at it as a compliment to your weakness. On that positive note, I wish to say that I have presented a good IOL in the best possible manner in the shortest time period available. Thank you very much.
Thank you, Dr. Mohammed Sayee. It was very nice. 7 minutes talk.